In the hemodialysis setting, when we talk about continued education, we're more focused on annual competencies. We all know that when you start orientation for a new facility, oftentimes they have you go through infection control courses and courses on how to troubleshoot machines that you may be working with in your acute care setting or hemodialysis setting. And also they talk about patient safety, identifying the patient before you give medications, avoiding needle sticks, avoiding contact with contagious substances such as people's blood, all of those great things. So with continued education in the hemodialysis setting, we're more so focused on knowing your job description, knowing those things that are within your scope of practice, and also knowing the things that you need to take care of to maintain patient safety. The work environment. We all know that the work environment plays a major role in how well you're able to do your job. The work environment, often for a nurse, is stressful, but you should be able to maintain certain factors, such as your patient caseload. If you feel like you're overwhelmed, you should definitely, identify those problems to the appropriate sources. So with the work environment, you want to make sure that you're organized, that you know your patients, what you need to do with those patients, that you maintain your time management so that you can get the correct tasks done within the amount of time that you're allotted. So here we have a case scenario that I added to my presentation, so I'll briefly read that to you. Nurse Betty is assigned to take care of all the patients dialyzing on Pod 2 today. There are approximately 8 patients in her care on Pod 2. Nurse Betty begins drawing up Pectoral and Epogen for 2 of her patients, Ms. Hahn and Mr. Vance, but is immediately called over to assist in cannulating another patient before she could label the medication. Before being able to return to drawing up medications, Nurse Betty was also asked to complete pre-assessments on 2 other patients and took phone orders from Dr. Singh. When Nurse Betty returned to the medication area, she found that one of the syringes of medication she previously prepared was missing. She asked her fellow nurse co-workers if anyone had seen the medication. Nurse Maggie informed Nurse Betty it must have gotten mixed up with other patient medications, and she took the initiative to pass out all the prepared medications to help balance everyone's workload. So with that being said, what are some things that could have been done better in the scenario to prevent medication errors?
Labelizing drugs and minimizing work distractions.
That is also listed as 2 of the causes for medication errors for nurses. The work environment being stressful, extra tasks that come along unexpectedly, being pulled from one area to another before you're able to complete one task. As well as I said, on our unit, we don't scan medications, so you have to make sure that as soon as you drop those medications, you label them so that even if you're not able to give them at that very moment, you know what patient those medications are supposed to go to. So after discussing all the research that's been done, things that have been identified as being problematic for nurses around the world, what is it that I can do on my unit to minimize medication errors? So the first thing is, anytime you're given medication, whether it's in acute care, you're on a hemodialysis unit, an oncology unit, you always want to make sure you're observing the patient's 5 rights. Is it the right patient that I'm giving this medication to? Is it the right medication that I'm giving to this patient? Is it the right dose? Is it the right time? Am I giving it within those parameters set out by my facility that I can give this medication? Also, am I documenting, what medication I gave, if I observed any adverse reactions when I gave the medication? You always want to make sure you're observing that. Secondly, with the incident reporting, even if your patient doesn't go through an adverse effect, you want to make sure that you report that incident so that other nurses can learn from your mistakes. And you also have to have an environment that conducive to nurses reporting their errors. You don't want to feel like, of course you're held in accountability for your errors, but you don't want to feel like, oh, I can't tell my manager this, because people learn from each other's mistakes. Also, you want to make sure that when you do see things that you feel like could be better on